We know it impacts about 10% of fathers in the first year, that about 10% of men in the first year postpartum will experience a major depressive episode. And we know that screening fathers for conditions like postpartum depression for PPD is hugely valuable. It's been certainly validated. The screening tools that are commonly used for moms have been validated in dads. It's been a sort of slow process to get that awareness out, even that fathers can experience postpartum depression.
Right, because when maybe they've heard postpartum depression, what do they tend to say?
When they first hear about postpartum depression, they say, I had no idea. And also, no one knew. Or I didn't share it, or I didn't even know it was a thing. And in fairness, I didn't know it was a thing. That sort of speaks either to, my being oblivious, but I think it sort of speaks more to training and medical profession being relatively oblivious itself. There really was no focus on the fact that dads can also experience postpartum depression. In fairness, there's a lot that is wrong about postpartum depression in, the classic books that we use and diagnostic criteria that we use to identify postpartum depression, both in moms and in dads. And there's no mention of this being a universal experience, meaning that it's not specific to mothers. Well, there's no mention of necessarily moms only. The fact that there's not a mention of the possibility that this can emerge in fathers within the diagnostic criteria within the DSM sort of sends this message that it's only a maternal thing. It's also kind of got it wrong in terms of the timing, and that's important, especially for fathers, because the timing of postpartum depression in men is a little different than in moms. The way it shows up is a little different. We know it impacts about 10% of fathers in the first year, that about 10% of men in the first year postpartum will experience a major depressive episode. And there's a lot of reason to believe that that's an underrepresentation or an underestimate, just based on the fact that we don't often share our experiences openly, but also based on the way in which men experience depression. It's slightly different, and sometimes means that those of us who experience depression don't get identified in sort of the classical ways. But about 1 in 10 men will experience postpartum depression in the first year. If mom is experiencing depression, then that rate goes up substantially. It becomes somewhere around 1 in 3. It's somewhere between 25 and 50%.
Wow. So significant increase in...
Huge.
That's massive.
Yeah.
Wow. Geez. Kind of how it's defined, right? Can you speak a bit more about that? Like in the DSM, for those that don't know, that's the Diagnostic and Statistics Manual for Mental Disorders, which we use as part of our training, as part of our criteria for diagnosing quote unquote mental illness, and what we use to kind of identify. PPD actually, at least in the DSM, is defined as it's actually a major depressive disorder with a postpartum onset. And this is all like scientific mumbo jumbo, but essentially there's clear definitions and clear criteria that has been laid out that we as clinicians would use to diagnose a particular individual with symptoms. But what I'm hearing Pierre say, and I agree, is that there's some things here that are missing, even though we're seeing this kind of postpartum depression symptoms in men, but in the manual, there's a big gap. Can you speak a bit more about why you think it might be and what you're seeing there?
It's a disservice to fathers, but it's even more so a disservice to moms. And that is that the criteria indicate that a major depressive disorder has to happen within 4 weeks of the birth of a kid. And we know that that's really not the case, that research supports an increased risk for depression and also for anxiety disorders within the first year. Many researchers are actually extending that period of risk to 18 to 24 months. But by and large, and that's still sort of questionable, but by and large, most of the research and literature that supports looking at the time period of risk is in the first year postpartum. Now, for fathers, this is particularly a problem because the period of greatest risk for fathers is months 3 to 6. That tends to be the period of greatest incidence of major depression. Now, it's hard to say the time period during which men come to the fore in terms of awareness and identification of a depressive episode, whether it takes longer for us to even articulate it or longer for anyone to notice it. But in many men, the symptoms sort of start really slowly, gradually. The onset is really insidious. And so many times it's described almost like a personality change. Dad's shifting in his personality. Well, understandable, because it's not the classical I'm okay one day and then the next day or the next week I'm at the peak or at the valley of my depression. It's relatively slow and steady and tends to peak pretty late on. And so a lot of the features as well, and that's clearly outside of this sort of 4-week time frame. But that's also the case for moms. For moms, it tends to be less insidious. It tends to be earlier in the first year, but the risk is still within that first year period. And so that diagnosis might miss postpartum depression in moms and fathers. And the experience of depression, and this is something I think too we can speak about, the experience of depression tends to look a little bit different for men. And so even the diagnostic criteria alone can be problematic when it comes to identifying depression in all men.
They're in that phase of like, oh, here's what I'm experiencing, and it could possibly be then postpartum depression or PPD. What are some of those things, just to kind of put language to it, and so they know to look for? What are those things that you're seeing? And then maybe also talk about maybe some of the uniqueness that men be expressed or manifest in men that might differ from the current standard criteria.
Sure. Yeah, absolutely. And so by the book, I think it's important to acknowledge what a major depressive episode looks like. It's 2 or more weeks of a change in symptoms and mood, usually involving a decline in mood or irritability of mood alongside a reduced experience of joy, not finding pleasure in things that you might normally. And that's typically associated with a slew of additional symptoms that are in line with sleep deprivation and changes to sleep, rather, too much or too little, changes to appetite, again, too much or too little, feelings of guilt or worthlessness, decline in interest, again, that's a pretty common one, change to energy, usually that's a decline. In some cases it can be a bit of restlessness, changes to concentration, difficulty staying focused, slowing of movement, or restlessness. So basically a change to this feeling of motor activity or psychomotor activity, where you might feel more sluggish or you might feel more restless. And then in more significant cases, a sense of hopelessness or even suicidal thinking. And often you need some combination. Usually it's about 5 symptoms over the course of 2 weeks. Important.
It is important to know. And also, too, it's you're experiencing it most of the time over that 2-week period.
Yep. It's not just limited to certain periods of the day or certain experiences.
Right.
And it's not just limited to the context of something like a major loss or grief.
Right.
So that's important.
You're right. Important to differentiate, because some of these things we can experience from loss and grief, and we could have probably a whole other show talking about.
Yes.
That. So that's pretty some of the standard criteria.
That's standard.
Which is good, because that's been widely researched, tons of studies backing data to show this is kind of what we're seeing. And it's a great place to start to understand and ask questions. And I would say a lot of men, if they're experiencing depression, for sure will fall under these criteria. Absolutely. But I'm wondering, in your professional experience, and maybe even some of the newer research and data that hasn't come into more of a standardized criteria, but the stuff that you've worked, the stuff you're passionate about, what are some of those maybe more unique expressions of depression, PPD in men? And again, this is going to apply, I know, not just to fathers, but just men in general.
Yeah, it does.
So what are some of those things that you're seeing?
Yeah. So for starters, I would say maybe the biggest area or the biggest experience that interferes with identifying depression in men is that often we don't describe this feeling of sadness or this feeling of depressed mood. That quite often it feels more like numbness or depletion or fatigue. And so, sure, there may be some stigma around or some hesitation to share the experience of depression, because it sort of, in many ways, it sort of violates this sense of having it all put together, being strong, not being vulnerable. On the other hand, the actual experience may be very different for men. And so important that we recognize that. And because it's such a linchpin of making the diagnosis, if a man doesn't acknowledge experiencing depressed mood, then you're probably not going to have the diagnosis of depression. In many cases, men are more likely to experience irritability. We're more likely to experience attacks of anger. On top of that, we often think about tearfulness or episodes of crying as common to depression. But obviously, there are many stigmas and barriers to expressing emotion for many of us guys. And I would say on top of that, research has shown that in men, there's often an experience of numbing, of avoidance of emotion, and not necessarily volitionally, not willingly, but sort of feeling devoid of emotion. And so important to recognize that too. But there are a number of additional ones like restless irritability, this feeling of needing to move, feeling easily angered or frustrated over little things. We tend to experience a tremendous amount of self-criticism, flogging, guilt, which is common in dads, a change to decisiveness, or guys might experience this as a change to my level of confidence. There may be a sort of even slight sense of indecisiveness, difficulty making simple decisions. Additionally, we have a tendency to externalize, to try to use other things to reduce the sense of numbness. That might be in using substances. It might be in gambling. It might be in risky sex. You may find ways to reduce that kind of sense of feeling numb or wanting to escape. So those are quite common to men. In fact, those are the ones that tend to be most troubling, I think. This feeling of guilt or feeling like I'm not worthwhile as a father, or I'm having trouble with making simple choices around parenting or in my relationship with my wife. I want to be left alone, or I might feel guilty about wanting to be left alone when I've got to take care of a kid and be in relationship with my partner. And so those are commonly the experiences of depression in men, but certainly in the postpartum period.
Yeah.
And they deviate from what's in the book very substantially.
Absolutely, they do. And I could say from my professional experience as well that I see that numbness is a big one I see in men, whether it's just a guy with depression, a man, or a father who has experienced it. And it's right, that linchpin meeting, that's like the number one criteria within the first 2 weeks is like, it must be depressed or sad mood. That must be included in the starting off point of like diagnosing, is this must be part of it. But a lot of men have that numbness and void. They can get away from that and veer away quickly, even though they have all these other criteria. It's like, well, they don't have this.
And, it's common, I think, early on in training and experience to sort of count criteria as the goal from a clinical standpoint. And the reality is, sometimes people don't show up with the stuff that's in that book.
Nope, a little more unique and complex.
Yeah.
Those unique expressions I do see. More irritability, more risky behavior, addiction, and different things to kind of maybe fight some of that numbness, to feel something. But often then it could lead to other problems, unfortunately.
Yeah, it is unfortunate.